Hello, and welcome back to Wisdom Wednesday. This week we will be discussing Ramsay-Hunt syndrome as it's been in the news with Justin Bieber. What is Ramsay-Hunt syndrome? Ramsay-Hunt syndrome is a rare disorder that's caused by the herpes virus, varicella zoster virus, which is the virus that is responsible for chickenpox. Once you have chickenpox, the virus will lie dormant in the geniculate ganglia until it's reactivated. Ramsay-Hunt syndrome, also known as herpes zoster, gives a shingles-type rash in or around the ear with cranial nerve 7 involvement. The most common cause of Ramsay-Hunt syndrome is stress, which leads to a weakened immune system, and this allows the virus to become active again. There are two variants, with or without a rash. Without a rash is a little bit more difficult to diagnose because it is the differential between that and Bell's palsy. The rash, if present, occurs in or around the ear and may extend to the oral cavity, intra and external. It may extend to the face, neck, as well as the chest. What we know about the cranial nerve, if you take a look at this schematic, you see where the branches go onto the face. The facial nerve is responsible for facial expression and taste on the anterior third part of the tongue. So when this nerve becomes paralyzed, it produces certain symptoms. As seen in this picture with Justin Bieber, you will see the inability to move the lower part of the face, to completely close the eye, blink. They complain of a decreased taste, hearing loss, of course the blistering pain from the rash, deep pain from the facial nerve swelling, and other multiple cranial nerves that may be involved. They have problems with speech, and a plethora of other problems depending on the severity of the nerves involved. For example, the severity of the vestibulocochlear nerve may include associated dizziness or vertigo, balance issues, or headaches. The diagnosis is based on the presentation of the patient and a physical exam. Confirmatory diagnosis will include an MRI, as seen here, where we're looking for facial nerve swelling per the era. Audiometry to assess the hearing loss, blood tests, and other lab tests to detect the viral load, the viral DNA, as well as other markers for the syndrome. Treatment will involve antivirals, steroids, and facial nerve exercises, as Justin Bieber discussed that he was also doing, as well as medication for symptomology. For example, for nerve pain or neuralgia, we tend to give anti-seizure medications such as carbamazepine, as well as opioids. For dizziness or vertigo, we tend to go with an antihistamine such as meclizine, but other medications can be prescribed. The eye is affected with the inability to blink, so to protect the eye, we give re-wetting drops as well as eye patches, and so forth, based on the presenting symptoms. While prevention is not 100%, but because Ramsay-Hunt syndrome is extremely rare, meaning there are fewer than 1,000 cases in the United States, it is recommended by the CDC that you take the chickenpox vaccine if you've never had the chickenpox. This is for children, adolescents, and adults, and they recommend 2 doses. As well as they recommend 2 doses of the shingles vaccine for anyone over 19 with a weakened immune system. This should be discussed with your primary care physician. Recovery of Ramsay-Hunt syndrome generally is around 3 to 4 months, and we like to start treatment within 3 days of symptoms. This can sometimes be difficult as the rash is generally the first symptom you see prior to the facial paralysis. It is remember, unilateral facial paralysis. With treatment, we do expect 100% recovery is possible, but some individuals may notice that they have a deficiency over time. For example, in Justin Bieber's case, he's a singer, so he may notice that he's not able to hit certain notes or sing at certain ranges as he did before. This is due to the severity of involvement of the facial nerve and other cranial nerves. Some choose no treatment, and in medicine, no treatment is also a form of treatment. Without treatment, about 20% of these people will have a complete recovery. But that leaves about 80% of the group with one or more complications or deficiencies after 3 or 4 months. Severity of the nerve damage, once again, will dictate the percentage or level of recovery. What are the long-term complications of Ramsay-Hunt syndrome? Well, there can be permanent paralysis from the nerve damage. There can be facial asymmetry, meaning that the face is not the same size. Eye damage, not even just from the intracranial damage, but also from debris that may blow into the eye, decreased lacrimation or tearing due to no blinking, in addition to the nerve damage. The milder the facial paralysis, the more likely the complete recovery without complications, versus the severe paralysis, which means multiple cranial nerves are affected. If you have any questions, drop them down in the comments, and yeah, let's have a discussion. Thanks for watching. See you next week.